Welcome to Super Families with Sue. I'm glad you could join us. My name is Sue Karoga. A story is told of a heavily expectant mother who was walking along a river together with her 3-year-old son when suddenly the son fell into the river and the woman started screaming helplessly for help. By the time help came, the son was already dead and she discovered that the river is only 2 feet deep. She could have easily saved the son. Knowledge is power. Proverbs chapter 15 verse 14 says that the discerning heart seeks for knowledge, but the mouth of fools feeds on folly. It's important that our children gain all the knowledge that they can acquire at a young age. Let us not sacrifice a good education for our children on the altar of money. Join me. A very warm welcome and thanks for watching. It's back to school, as you can see, after COVID-19 season, and we are trying to collect the uniform and the bag and the books and put them together ready for school. I don't know whether you are ready for school because the Minister of Education already announced that the children will be going back to school, and the Form 4 and Class 8 candidates are supposed to report back on the 12th of October 2020. And many parents have really complained, and indeed even the learners, because earlier on the government had said that the pupils will be going back to school in the year 2021 and that we should consider the year 2020 lost to COVID-19, only for them to turn around and now say that the kids need to go back to school. It's time for them to go back to school following a little bit flattening of the COVID-19 curve. And so now we are here, and when I first heard about this, and as a mother of a candidate, there were so many thoughts in my mind, and I was wondering and thinking, so what do I do? And so right now I would like to share with us some perspectives and even some of the preparations that I'm doing even as I prepare my son to go back to school. And so the first thing I think we need to really do as parents is to align our thoughts. Irrespective of how we feel, maybe we think we don't have resources, or maybe our children should have actually just gone back to school in 2021, we need to align our thoughts because the government has said there's no turning back. The kids must report to school. And so as parents, we need to align our thoughts. And the first thing that the first question that comes into your mind is, so now, will my son be safe? Will my daughter be safe from COVID-19 if they go back to school? And so I quickly went to the WHO website and also UNICEF to just see the data they have there. And one of the things I observed there is that the rate of infection for children stands at 8.5%. So the chance that my kid will actually get the disease is very, very low. And that was actually comforting to know. And the other thing I observed was that the illness among children is usually not severe. In fact, most of the time, many of the children will have the symptoms and you will not even detect it. You may not even be able to tell that they actually have caught the disease. It actually goes unnoticed and they don't actually require medication or even hospitalization, which is also a good thing to know. And so as long as the child is going to school, and even considering that they most of the time will be interacting with their peers, then the chance that the kid gets the disease is quite low, and even if they get it, there is a higher chance that you will not even know about it. And so I think that gives us some kind of comfort as parents, even as we get ready to release our children back to school. So align your thoughts and your mind that although you cannot guarantee 100% safety of your child, but relatively they are safe. The second thing that you need really to be clear in your mind is the importance of education, and a good education for your child. Don't entertain the thought that your child can actually do without the education, and this will come in particularly very handy for the teenagers, some of whom were already in working areas and they were earning some money, and they have started to feel that, okay, education is not all that important. After all, I am making money and I don't have that certificate. Let us not entertain those kind of narratives and those kind of stories. Knowledge is power, and a good education remains a very important key for life. And so let us make sure we are clear in that in our minds, because concerning particularly teenagers, the way they are going to go back to school, or whether or not they go back to school, will also depend, especially those ones who are not very motivated, will depend on the firmness of their parents and guardians. If they know that you are clear on them going back to school and getting a good education, they will most likely be obedient and go back to school. But if they realize you are 50-50, are not very clear on whether education is important, then they may start coming up with narratives of telling you, after all, the education is not very important and they can save you from paying the school fees. But that's not good for our children. Let them get the education when they are young. And remember, the importance of a good education cannot be overstated. And then the other thing you need to align is your resources. Please work with the resources that you have. I know we are going through very difficult situations and hard times, but irrespective of the resources that you have, the most important thing right now is to ensure that our kids go back to school. That is the most important thing. And where there is a will, there is a way. So if we decide in our minds that we are going to take them back to school, then the next thing we need to do is to find out how. Now, our kids are going for the second term. It's not the beginning of yet another academic year when it's normally very expensive because we are buying so many things and textbooks and all that. They are going for the second term. So as much as possible, let us locate their books and their pens and their geometrical sets. Let's try to locate the things that they were using before, so that we minimize on the things that we are going to have to buy right now. And I know that they have been eating and most of them have grown more than 2 sizes over. So perhaps maybe the challenge is going to be with the uniform, but we can also try and work out around that until we are able to get resources to be able to buy for them new uniform. So it's possible for you to check, for example, on the seams of your child's clothes or uniform, see whether it's possible for them to be expanded and you could be able to be enlarged, and you can maybe look at that as an option. The other thing you can do, you can look for a shirt or a blouse or a skirt that actually is close to the uniform of your child, and then you go to school and explain to the teacher about the situation you are going through, and you have them give your child a little bit more time for you to be able to buy for them the uniform. The same applies to even school fees. Perhaps right now you may not have the money to pay. The first thing is to have the child report back to school, and then you go talk to the principal, to the teacher, and negotiate so that they give you some time to be able to get the money that is required. Because right now everybody understands that the schools have been opened abruptly, and some parents were not ready. And actually the cabinet secretary has said that the principals and the heads of schools should not send children away. So as much as possible, you will be given time. So the most important thing is to go to your child's school and communicate with the teachers and the administration so that they can consider your plight. And then after that, the second thing that we really need to do as parents is to prepare our children psychologically. Remember, our children were prepared to go to school in 2021, but now they have been called back and they are suffering from a lot of inertia. Like a stalled vehicle which needs to be jump-started. That is what we need to do to them. So we are going to have to give them a lot of psychological and moral support. And the first thing we need to do is to alleviate their fear of contracting the disease. So sit down with your child and explain to them that they have a very low chance of getting the disease, and that even if they get it, the symptoms may not necessarily be very severe like for grown-ups, so that they are psychologically prepared to go back to school. Then let us also repeat ourselves over and over again concerning the importance of a good education when you are young. It's very important that we sing that song and prepare them and and encourage them and tell them so many stories of why education is important. Because after all, they may have started earning some few coins here and there, but you remember, as a person of faith, the Bible teaches us to seek knowledge, to seek wisdom and understanding. And there's nowhere the Bible tells us to seek for money and wealth. Remember also that the same Bible says that the years of man are either 70 or 80. Now, assuming that your child is going to be 70 years old, live to be 70 years of age, and perhaps right now they are 15 years old, then they have another whole 55 years for them to look for that money that they think is so important. And so the same Bible says there is a time and a season for everything under the earth. Right now your child is young, they have very few responsibilities, and therefore it is their time to go to school and acquire all the knowledge that they can get. So encourage them. Although they were earning some few coins here and there, a good education is very important, because knowledge is power. So we will need to really prepare our children psychologically, because a well-prepared child is going to be well adjusted to go to school. They are going to be able to overcome that inertia of staying at home for 7 months, and they will be able to catch up with their studies very fast. The other thing we will need to do is to insist on our children that they practice good hygiene. Very important. Those COVID protocols we have been told over and over again, washing our hands with soap, social distancing, the issue of wearing of their masks. After all, they are required to go to school with their masks. We will need to repeat those as well. And it's good that we remind our kids that although they may not get the disease, and even if they get it, for them it may not be very severe, but if they bring that disease at home, then the parents or other grown-ups at home may catch it, and they may get very sick and may require to be hospitalized or even sometimes die. And so that's a very bad scenario. And therefore, the child needs to be told that they need to take care of themselves, not just for themselves, but also for the other people that they live with at home. And so let us encourage our children to practice good hygiene. Now, another thing that is going to be a very big challenge is sharing. We need to really discourage our kids from sharing, because kids share everything. They share utensils, cups, plates, spoons, they share everything. We really need to discourage that behavior. And one of the things to do that is to try and make sure that you supply as much as possible everything that your child requires, so that they do not need to borrow from anyone. Let them carry their drinking water. Let them use their own utensils if the school doesn't provide. Let them use their own pens and pencils, so that they can as well protect themselves from infection. And then the other thing, let them keep the mask on. That is going to be a challenge for most of them, but let us encourage that behavior, because we are told that we should not touch our face, our nose, our mouth. But the chance is, if the child is not wearing a mask, they are most likely going to touch their eyes or their mouth. But if they are wearing their mask, then that probability, is reduced. And also, we are being told to cough into our elbows. But the chance that the child will not do that, when especially they are not wearing a mask, is very high. But at least if they are wearing the mask and they cough, they protect the neighbor, from an infection. And so let us insist right from home, the children will practice good hygiene. And now, when they go to school, the work of the teacher will just simply be to reinforce what they have already been taught at home, because again, we are insisting that charity begins at home. Now, the other thing I need to mention here is what is also recorded there on the WHO website, and that is children with underlying conditions. And they have talked about respiratory diseases. They have also talked about diabetes, things like cancer, and even obesity. They have talked about that. So if your child suffers from asthma or has acute bronchitis, then before you take them back to school, think about it and look at the first thing, that is their current health status. How are they? Have they been very down? Then it will be better to keep them at home for some time until they are stronger to be able to go to school, so that you avoid the probability of them getting infected. And then you will need to go to school and talk to the class teacher, so that you can discuss, and they will be able to advise you accordingly concerning what you can do to help your child, and so that they can be able to also cover the work that the others will be covering when they are in school. That is important, especially if your child is a candidate, so that they are not disadvantaged. So it is important that you work closely with the teachers, so that now you can constantly, be able to monitor the health of your child, even as they are also able to acquire the knowledge that is required. And then the other thing that we need to mention here is the need to constantly monitor the health of our children. If your child is in a boarding school, then when they go to school, there's very little control that you have. But if your kid is a day scholar, it's possible to closely monitor their health. And if you have an apparatus like this one I have here, this is a thermometer, you can use it. You can be able to record your child's temperature in the morning and in the evening when they come back from school, so that if there is an issue, you can be able to pick it early. The other thing is that we need to realize, although we are talking about COVID-19 all the time, the other infections are still there. So it's not necessarily that if your child has a fever, then they have contracted COVID-19. It could be malaria. So let us not, panic every time that perhaps your child has got an elevated temperature. It's good that we take it as it is, and then we seek, treatment, and the doctors and the nurses and the hospital will be able to deal with the situation as it is. And then the other thing I need to mention here is we have been told a lot about, teenage pregnancy, which actually has been a crisis during this COVID-19 season. And if your daughter is one of those that made that mistake and perhaps they got pregnant, it is important that that one mistake does not, ruin the rest of their lives. And so if your child is one of those, you will need to go to school and talk with the class teacher so that you can come up with a working formula for your daughter to have them take their exams, particularly if they are candidates, so that they are not disadvantaged. You really need to make sure that your child continues with education despite their pregnancy, and that's very important. Then the other thing that I need to mention here, and charity again begins at home, is the issue of stigmatization. We really need to encourage our sons and daughters and our boys and girls against stigmatizing other children because of either an underlying condition or even because of pregnancy. Anybody can get pregnant. If any girl can get pregnant, and if boys had wombs, they would also get pregnant. So it is wrong for us to stigmatize a girl because of pregnancy. Let us accept that that is a normal biological function and a mistake can happen. And if it happens, then let's not condemn that child for the rest of their lives. Let's give them an opportunity to correct their mistakes and encourage them. And so it will be important that we have those kind of conversation with our children right from home, so that when they go to school, they will not pick on other children because of their underlying condition or even because of that pregnancy we are talking about. And when all is said and done, it is impossible for us to assure 100% safety for our children or even for ourselves. And that is why we really need to pray and ask God for his help to protect us. We talked about, when we were discussing earlier on in one of our videos, we talked about the spiritual pillar, the need to constantly pray and ask for God's protection and God's covering, so that our children and even ourselves will not fall sick of this COVID-19 or any other infection for that matter. So take it to God in prayer, pray in the morning, pray every time, and ask God for protection. And therefore, if we do those things, I believe we will be able to take our children back to school comfortably and have the peace of mind that it shall be well with them. And so with those few remarks, I beg to stop there. God bless you, have a good time, and let's take our children back to school. Thank you.